Okay, so we're going to go ahead and get started. Hello and welcome to iTeniv's webinar. Today we're going to be presenting a sneak peek of the practice management enhancements in NextGen 5.8 UD2. This is the 9th installment of our educational webinar series, and we hope that you find it interesting and beneficial. My name is Chelsea Lukens, and I'm the Marketing Communications Coordinator for iTeniv. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded. Next, I'm pleased to announce that our next webinar will be this coming Tuesday at noon Eastern Time, and it will be on evaluating your practice's financial health, where we will take you through assessing the current state of your practice, including how do I know? What do you look for? What should I change? It should be an insightful one that we hope you join us for. Moving on, at the end of the presentation, we're going to open the floor up to questions from you. We will answer all of the questions at the end, but you may type them in the questions area of the webinar control panel whenever they occur to you. Finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please let us know using the chat box so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters today. First, Cynthia Kincaid is Vice President of Consulting Services at iTeniv and a Certified Practice Management Executive. With over 25 years in the IT healthcare industry and 8 years with iTeniv, her experience runs wide and deep. This makes it possible for her to provide the insights needed to help healthcare organizations experience great success no matter what the challenge is. Next, Jeannie Logue will be joining in. She's also been in the industry for almost 25 years and is the Director of Management Consulting at iTeniv. She has worked here for 3.5 years and lives and breathes the industry, travels across the country seemingly nonstop, working with our clients at their locations. Finally, Sean Harvey will be jumping in with additional information and to answer your questions. He's been with iTeniv for 1.5 years. He originally joined us as an intern while he completed his degree in Health Information Management Systems at The Ohio State University. Since then, he really has become a true NextGen expert and has fully immersed himself in the UD2 enhancements. Cynthia, I'm going to go ahead and pass the webinar off to you. Feel free to get started when you're ready.
Okay, great. Thank you, everybody. First of all, I would also like to emphasize that Sean Harvey did most of the work on this webinar, did a lot of the testing, and has been working diligently to test UD2 in our test environment as we work through the beta process. Today we're going to be talking about PM enhancements and the features to be excited about, and there are quite a lot of them, and some of them may seem minor to everyone, but for those of us who have worked with PM for years, some of these have been waited for a long time, and we're really excited about moving forward. First of all, a little housekeeping from our last webinar. As many of you, we had a sneak peek of the EHR enhancements in UD2, and we realized that we had peak versus peak. Actually, we looked up the definitions, and so we'll let you know that a sneak peek is an opportunity to see something before it's officially available. That's what we did last week, and that's what we're doing this week. A sneak peek, which is what we had, is a sly, crafty mountain. And while sometimes upgrades seem like you're climbing a mountain, that was not our intention. It was just a mistake. And we wanted to let you know that we did discover it, and we are moving forward with a true sneak peek today. First of all, our agenda. We're going to talk about when, why, what, who, and how. So first of all, when? The 5.8 UD2 expected release date is April 22nd, 2015. That has not changed, and we really look like it's on track to move forward this time. Why would you do this? UD2 offers many enhancements and new features to benefit your billing and front office staff. This is one of the most encompassing releases that we've had for a long time. As I mentioned last week, basically, NextGen has had to focus for so long on regulatory changes, getting ready for ICD-10, which was postponed. It's also had to focus on EHR, meaningful use, and just kind of governmental things. And for this release, they have really taken time to focus on usability, functionality, and making your lives better. So what? Let's talk about the enhancements to be expected. First of all, we're going to talk about the enhancements. There are enhancements to demographics, insurance, reporting, letters, SIM groups, PM patient portal integration to EPM, transactions, authorizations, claims, eligibility, NDC codes, bad debt, and anesthesia concurrency, which is an area that's also been largely weighted on if we have any groups that are using anesthesia in the webinar today. So first we're going to start with demographics. We're going to touch on each of these areas, and we'll start with demographics. So the first thing we're going to talk about is in patient demographics, they have added the ability to arrange the order of the race drop-down for patient demographics in the EHR or NPM. They've added patient notification icons and default preferences for communication. These are reportable, and the changes are tracked in significant events and clinical history notes. So let's talk about the race selection. In the past, you were only able to associate one race with a particular patient, and many times that's not the case. So they have added the availability to multiple races, and you can now put these in an order and move them up or down based on the patient's preference and the patient's notification to you. Going to the reorder, this is really how you would reorder them. You would basically check the races in particular, and then you would use your up and down arrow keys to reorder them and make them available based on the patient's notification to you. As we move on to notification preferences, they have actually now added the ability to see the notification preferences and prioritize them in different places. So we've just looked at a couple of the areas that you can see the notification preferences. So you have your notifications here. You have an ability to opt out. And then you can put that whether the patient wants to be notified by email, phone call, or text message. And then you can actually, based on how you put them, notify them, put them in the order that the patient prefers. So in this particular case, the patient would prefer email, a phone call, and then text. If we move on to insurance, the encounter insurance selection, new columns, and this is one of my favorite things, and Sean was very excited about this, and I know Jeannie as well. They have added new columns to display patient insurance information, including, so you can now see when you're selecting the insurance, the policy number, the insurance card on file, detail 2 information, benefit information, authorizations, referrals, and if you're using RTS, the eligibility. They added the capability to add, remove, and arrange columns on the insurance selection screen based on user preference. So this is a user-specific change. So how you go about this is as you're highlighting your insurance, when you've looked at the available insurance, you can right-click, and these are the items that are selected for display. So you can see you can check or uncheck those as you could in any typical EPM screen. And that's how you add or remove columns. And then when you want to view it, you can actually hover over the blue push pins with the indication that data is included, and you will see when you're hovering, the last card attached in this particular case was on 3/10/2008. And while, again, a lot of these will seem like small things, these have been areas that you've really had to go hunting and pecking to find this information, and this makes it very easy to just view it at a single glance. As we move into reporting, they have added enhancements to the reporting tool with new columns that have been added to the Unapplied Report. And Unapplied is an area that's always a challenge to work, so this was a welcome addition. You've got new column names now, guarantor name, birth date, the charge amount, the insurance 1, 2, and 3 amount, patient amount, encounter copay, line item amount, process date, and then as each of these columns have been added, they've also added the associated column filters so that you can filter on these and sort by these. And this is just an example of how this might look. So here's your Unapplied Report, and these are your new columns that we're displaying on the left, and over here you can include the following items on the report, just as you can with EPM. Again, functionality hasn't been changed. This is just new features to the reporting tool for this particular report. Report searching. Text search capability has been added to reports. While there was always some capability with the flashlight icon, this is now consistent throughout. And basically, you've got the flashlight icon added to the toolbar to populate your search functions. And your searching abilities now include text fields, find, next, previous, cancel, stop, and match case. So this is really a nice feature in being able to, as you generate the reports, go over and look for the data that you're specifically trying to ferret out when you're generating the reports. Report tasking has been enhanced. So now you've got enhanced tasking from reports. It enables the user to choose how a task will be created and what data will be encapsulated in the task. Encounter task will send a task at the encounter level with the encounter-specific detail attached. Account task will send account-level tasks with account-specific detail attached. The option for both is available to create tasks at both levels if you choose to do so. So this is just an example of when you're generating a report, the Add Report Task screen, and you have Encounter, Account, Both, or Cancel. And then this is an example of if you can add tasks from the report, the source name, the source number, and the encounter type or the account type. If we move on to letters, I think from our perspective, I'd like to say that letters to me has always been a function in NextGen, but it's always been kind of very clunky and hard to use, and this has really taken it to a new level, and I'm really personally excited about this feature. First of all, they consolidated it in file maintenance. It was kind of split out because you had letter types and then your letter categories, and they moved it together. So now you've got letter types have been moved under letters option in the master's files as opposed to two separate locations. And the structure of letter modifications has been made significantly easier to navigate. You'll almost have to play with this to understand how much better it is. However, if we look at letter modifications, you can see that you now have the option to edit a letter header. So that allows you to do this without having to use SQL to modify it. It also has given the ability of a single click to add or remove a header, and you can view the creator and last modifier of the letter when you have it highlighted. So these are all new functionalities in terms of when you're modifying letters. It also has a new look and feel. The letter editing window has been enhanced to have a more Microsoft Word-like appeal. So if you take a look at this, this is much more Word-like than it was before. And in addition, they have added additional styles to populate windows to insert tables, images, and formatting text frames. So it's really a lot closer to Word than it has been in the past, giving you more powerful capabilities when creating the letters. In addition, the data repository has been added to enhance the macro section and expand the ability of letters creation. For those of you who tried to create these in the past, you were really limited on what you could insert into these letters out of the database. And they've actually expanded this significantly. And I'll just leave this for a moment to take a look at the data fields that they've added. All of them certainly can't be seen here, but you can see you've got appointment encounter information, case management information, charges, employer, encounter, UB2, etc. So just take a minute to look at this, and then within each of these sections, the fields are expanded beyond that as well. Finally, there's a letter conversion utility that's been added. Prior to utilizing the new letter functionality, your existing documents will need to be converted. Now, you don't have to use this. However, if you're going to, you are going to have to convert those, and as a result, NextGen has created a conversion utility. And this is just instructions as to where you can locate it on the local drive in the NextGen folder. There's a letter update utility that will be executed. And again, you can certainly get assistance from NextGen support on this, or if we're supporting you, you can get support from us. The simple blue window will populate with which users can convert the letters. And it takes a few seconds, but it only needs to be ran one time. And once you've done this, you exit the utility and restart the application, and your letters are now converted. So it's pretty easy to take care of. Now let's move on to SIM groups. SIM groups setup has been changed to allow the following. And this is something that they had before and may not be meaningful if you weren't using this, so we're going to touch on it just briefly. Allow a single CPT SIM group to be created with more than one unit. And it allows multiple entries of the same SIM in one group. You were unable to do that before, and this has been a request that we've had. So for those of you who use SIM groups extensively, this might be really meaningful to you and exciting, and others you may not really understand the significance until you need to have this functionality. It has added it, and it is a feature that's been asked for quite a bit. PM patient portal integration. As we move forward to more and more patients utilizing the portal, there was very limited functionality in PM, and you also could not really tell if the patient had registered for portal. So it was really kind of a report. I know many times we've had people to ask us to generate reports for them just to tell them which patients have been, or you had to go out and look for it. So they've added patient portal indicators throughout the application, and this will kind of give you an idea. So they've added it on the appointment book in the daily view. So we've marked it with a red square around it that you will now see this little indicator with a blue little head that the patient is in the patient portal. In the Add Edit Appointment window, it's been added there. The Patient Information window of the patient chart, this is the area where you see the patient's photo. And you'll see an indicator right there if they are registered in the portal. And then finally, the status bar at the bottom of the screen will also give you the same little indicator if the patient is a member of Patient Portal. This will help you in knowing if the patient has in fact registered, or also if you need to encourage the patient at the time they're checking in, or at, in this case, checking out, or even when they're on the phone and you're looking at the encounter screen, hey, have you looked at our patient portal? And as you move forward with meaningful use, it's going to be very important to be able to encourage the patients to utilize this functionality. So this is a welcome addition. The patient lookup in portal menu, enhancements in patient lookup. Patient lookup has been changed to add a patient portal column. So now when you're looking up a patient, you will also see that if they have registered for the patient portal, and this is simple yes or no. So the patient portal menu in PM, the patient portal menu has been enhanced to include 3 different options. Now, enrollment, online forms, and send a message. And the rights to this functionality can be added or removed in system administration. Prior to this, it was a little bit challenging to be able to do this. You could only use 1 or 2 of the functions, and you were not able to really incorporate the rights as who could and could not do that. So as we take a look at this, enrollment has been expanded into a separate menu to handle enrolling, locking, and unlocking patients. Again, this was a bit of a challenge, so this is just a new look and feel of how it looks. So you can see patient portal, enrollment, online messages, or send a message. And then when you're in enrollment, you can manage the enrollment, lock or unlock. And the online forms option has been added to the menu to assist in sending, importing, or revoking forms for the patient. So once again, patient portal, online forms, send online, import, or revoke. And for those of you who are using online forms, this is becoming more and more prevalent. This is really nice functionality because it allows you to manage it at the EPM level and at the times when you're really getting your first contact with the patient, as opposed to many times it's had to be dealt with in the EHR. So we move on to transactions. First of all, they've added advanced SIM prices. So prior to UD2, when advanced SIM was turned on, and many of you may not be using this, so this may not be meaningful to everyone on the call, but prior to UD2, when advanced SIM was turned on, the user-defined boxes would always be present. With the upgrade, these fields will populate only if they're designated with a label and if there is a price listed for that label in the SIM library. This eliminates confusion if you're using this functionality. So you can kind of see here, if we take a look at this as the enterprise preferences, when it's on, you don't see anything here, and then when you've got the user-defined preferences, you'll now see that they are marked and associated. There's also added a charge discount feature. This discount feature allows the user to apply a discount to a charge prior to releasing the claim. The discount adjustment code is created and associated with the charge in order to account for the amount removed. A checkbox has been added to the Modify Transaction Code information screen in File Maintenance to make the code available for discounts. So this is something you can set up. Discounts can be applied to the encounter as a whole or to a specific line item on the charge posting screen. And line items can be discounted at different rates. Discounts can be applied as a percentage of the whole charge or a specific dollar amount less the original charge. And discounts can be reversed by using the Clear Discount button provided on the discount screen. Now what this is largely used for is there's a number of reasons and a number of ways that individuals discount their patients. It could be that you're providing a cash payment up front discount. Many times, depending upon your specialty, you'll be offering various options to discount your patients, and this gives you the ability to do this. If we take a look at the screen, you can have charge posting discount. So this is the charge posting discount. Darla is the name of our patient. If you're going to take advantage of this and the individuals have the security to do this, you can do a discount adjustment code, and you can discount at the encounter or line item. You can do it by a percentage or by a dollar amount, if it's depending upon the circumstances. And you'll see the line item associated with it. And then once it's been done, you'll see that this has been discounted. To set up the discount feature, because a lot of people have been asking for this, so another area that I'm really excited about. To set this up, it is something you turn on the discount feature in File Maintenance, Practice Preferences, so you can enable the discounts and charge entry. You can create a discount transaction code to be used with the discount feature, so you must create your transaction code. Check the box that denotes discount to make it available for use. So as you can see when you're doing this, you've got the discount application, and this is how you can set it up. And create blocked users for those that should have no access to the code. So you can selectively choose who can and cannot utilize discounts. So it's a security functionality, as well as you can block users from being able to associate with these discounts. As we move on to the EHR crossover, a charge entry pop-up that indicates charges have been submitted in the EHR have been restructured to resemble the choices in the holding tank. This was a little bit confused if you were doing it before, because there wasn't a consistency between the two. So now, instead of yes, no, the options have been changed to process or reject, which makes them more descriptive of what they're actually doing. For those of you who accept these charges and have seen this, there's a lot of times the users, when they're accepting this, they think when it says no, that maybe you're just doing it, you're not going to do it for this time, and when you reject them, they're gone. So this really makes it very much more descriptive as to what you're trying to do. The buttons in the holding tank have been rearranged to reflect the pop-up in order for consistency. So now they're just in the same order. Sub-batch enhancements. For those of you who are using sub-batches, and we don't have a lot of clients who do, although some of the larger groups, or for various reporting purposes if you're trying to track certain types of EFTs and things, I have had individuals use this. So for clients that are using the sub-batch feature, the requirement for the number of payments is now an option. And I know that sounds really minor, and I'll kind of show you here number of payments, and if there's not, number of payments is gone. This used to be really hard because you had to actually know the number of payments, and if you didn't get it done, it wouldn't work. So this has actually been a welcome thing for those that are using it. This is probably one of my favorite, most simple features that they've added, account receipts. You can now generate an account receipt, and from the print icon on the transaction screen, an account receipt option has been added to populate a receipt of payment. And I can't hear any of you cheering, but for those of you who work front desk, I hope I'm hearing cheers out there. When printing the number of copies needed, the printer that will be used for patient receipts can be selected. Users can preview the document and print as needed. Moving on to authorizations. Patient insurance encounter. The patient insurance counter window has been enhanced to allow line item level authorizations and referrals anytime prior to the submission of the claim. This is also a really welcome addition. Prior to UD2, once a charge was entered, an authorization code could not be linked to an encounter. With the upgrade, users can manually link authorizations and referrals to encounters at either the claim level or the line item specific level. Please note that the change in labels for the authorization referral number as well as the new boxes for the line item specific detail. So this will kind of give you the idea of just how the screen has changed. This is controlled in file maintenance. Authorization levels can now be controlled in the payer master file and file maintenance. In the payer table under System tab Claim 2, there is a drop-down for alternate claim send method for authorizations and referrals. Authorizations can be selected at the claim level or at the line item level. This drop-down will enable the line item option for the end user. So this is where you would go to set it up. And now, as we move on to claims, I'm going to turn the presentation over to Jeannie Logue. Jeannie is very versed in RCM, and this is kind of her area of special expertise, and I wanted to let her share with you some of the new functionality and features. So Jeannie, go ahead and take it away.
Good afternoon, everybody. In the claims area, we do have a couple of changes that, again, are very welcome changes. As Cindy said, a lot of these enhancements in UD2 are things we've been asking for years, and it's kind of nice to see them kind of finally come to fruition and we can use them. So the first one is the COB window. The COB window has been altered to encompass all adjudications made on the claim. What this does is, in the past, if we posted a payment or a transaction or a zero adjustment and we had multiple per that transaction, we had multiple COB windows. Now it's going to actually encompass all of the adjudications onto one COB window for us. We also have the ability to click on a radio button and look at the COB for just that payer or all payer COB. So this is a huge win-win for us as far as coordination of benefits issues that we have on our claims. They've also added a new COB access. We can still go ahead and access the COB on the transaction screen, but now in the transaction, when you're looking at the transaction tab, you can right-click and you've got View COB window or View the COB all payer window. So there's an easier way to access that than to going into each individual transaction to look at our COB. In the practice preferences, we've got two new alerts that you'll want to go ahead and set up, and these are two new alerts for the COB. One is to warn on COB imbalance with allowed amount, and the other is to warn on COB imbalance with billed amount. And these will pop up the alerts when you're trying to balance your COB and hopefully get clean claims out the door for secondary payers. Internal control numbers. These are the numbers that we track resubmits on claims and our coordinated benefit claims. An enhancement has been made to populate the ICN received from the payer on all COB claims, resubmitted claims, and paper claims. The setting to populate ICN number and file maintenance has now been changed to send ICN on resubmission and will function similarly without flagging the claims to automatically go as corrected. So anybody that's currently having the issues, it's the Medicare issue where it does not go out as the original claim, it goes out of corrected claims. We have the 7s or the 1s on our claims and we're constantly going in and fixing those. This will resolve that issue. It will actually populate the ICN number correctly on the claim. So if this is enabled, the setting will populate the ICN and the resubmission codes that are designated in the payer master file. If it is disabled, okay, it's going to still say blank, and you could go into the header and actually populate the number yourself or enter the number as we have in the past. So in your payer master files and file maintenance, the wording is a little bit different. It used to say populate ICN, and now it actually says send ICN on resubmission. And then the Medicare ICN on COB claim setting in the payer master file has also been changed to read send prior payer ICN on COB claims. The functionality, this has also been extended to all payers that require this information, not just Medicare. So this is going to ensure that the secondary payers are receiving this information on paper claims. We want to make sure that we go into our claim print library, and we're going to drop down and make sure that we actually add that as well to box 22. So if you're dropping anything to paper claims still, you want to go ahead and make sure that you drop down and add the ICN to your paper claims as well. In the transaction tab, we always had the ability to go ahead and put a resubmission number prior to UD2. We could type it in on the transaction screen manually if necessary. The problem with that was once we actually did this, it locked it in place. So once we've done the upgrade now, this number can be changed at any time prior to claim submission from the transaction screen. So once we put that resubmit number in there, if we need to change it or fix it or update it, we now have the ability to go back in and make that change on the transaction screen, where currently today it's locked in and we can't make the change. Another change is our CAS segments. With behavioral health billing and encounter rate billing, there's been some new tabs that they've created for us to balance out the CAS segments. And these are our claim adjustment segments for our line adjudication. Typically, when we add a new charge currently to the claim, it is no longer in balance, and we have issues with the CAS segment. So this new tab is going to allow us to create an adjustment reason code for just this very purpose, and then it's going to keep these all into balance for us. So when we go into the COB window, it'll automatically balance these out for the user. And the encounter rate billing library is the same thing. It's a new feature that's going to go in there, so we're going to go into our encounter rate billing library, set this up as well. Because both of these specialties, behavioral health and encounter rate billing, we are actually adding a new code in there, and that's what's causing all of these to be out of balance. So this CAS segment will allow these claims to all be balanced out for us. And if you go into the behavioral health library, there's a new tab called Billing Options, and this is where you're going to pick your reason code that you're going to want to justify your balance adjudication in there. And in the encounter rate billing library, once you have this turned on, and basically if you've got it set to send the ER SIM as a unique charge line item and you state yes, you're going to be able to drop this down and do the same thing, enter a reason code that you want to justify that balancing adjudication. So anybody using encounter rate billing libraries right now, this has been a big issue with us because it's always out of balance because we're dumping in that second, T1015 code. So once we go into this, we'll be able to set that up, and it will keep those all in balance for us, and we won't have the issues that we're currently having today.
All right. Well, thank you, Jeannie. And I'll take it back over from here. So we're going to jump into a few eligibility changes. And basically, you've got now the option for a CPT Code Inclusion. So this new feature will allow clients to attach one or multiple CPT codes to an eligibility request to retrieve benefit data for specific procedures. And this has actually been requested quite a bit in order to be able to look at just what are you requesting the eligibility inquiry and what is the response you're doing. So you can do it specifically by one or multiple CPT codes. Moving on to the NDC drug codes or national drug codes, as we move on, NDC input. The NDC library and functionality in the application has been altered to allow the user to change the unit and or basis measure per patient. Ultimately, what this means is that clients will not have to have more than one entry per NDC code. The code can be entered into the library once and then altered on the charge posting screen for how many units are actually given to the patient. For those of you who are posting NDCs, this is a welcome change because it was always really a challenge because everything just had to be handled so manually. If the NDC code is attached to the charge in the library, it will automatically attach to the charge. If the units are not applied in the library, the window will populate automatically for user to enter the correct information. And moving on to bad debt. First of all, bad debt status has had a change, an enhancement. So now it's an optional new status that can be set in practice preferences that will keep patients that have fallen into this category labeled as such for reporting purposes. So currently patient encounters in bad debt are moved to a history status once they're paid. At that point, you have no real idea that the patient was ever in bad debt unless you actually start really digging into it. And many of our clients have requested if they're using this functionality and a patient was once in bad debt, they'd like to know it, perhaps for limiting more cash up front, etc. So now the following checkbox in file maintenance practice preferences will stop this from happening. So basically what happens is you can check this in file maintenance, and instead of moving to a history status, these patients will remain in a bad debt status on the encounter screen. And I'll kind of show you how this looks. So encounters that are currently closed and have a history status are shown. They go right to the little, what I call the door. They go to the yellow door. Now, if the checkbox is selected, they will now display. They will still have the little black background, but they will show as a green to indicate that that has been paid off, but they were once in bad debt. Further, they've enhanced the bad debt notifications along the same lines. There are also new alerts that can be automatically generated for patients that have previously been placed in bad debt. So if previously they were in bad debt, the following alert will appear, and you'll see you've got the same little icon. It shows that they were in bad debt, but it also indicates the account was previously in bad debt. They're not there anymore, but they were. So in addition to the alert, an update is also going to be created in the bad debt encounter note, and a separate line item will be added as followed. And it will tell you that the bad debt encounter reaches zero balance on, in this case, 3/24/2025. Just really probably not accurate. The last area we're going to talk about is anesthesia concurrency. And basically what I'm going to tell you here is they've added some areas to basically help with concurrency billing. And I'm going to scroll through this very quickly because I doubt seriously if there are many individuals on the call that are utilizing anesthesia. I will say if any of you are there, it's in the presentation, and I would be happy to discuss this with you. But basically they've allowed some contractual adjustments to be improved in the contract libraries, some process date changes, and they've added Gantt charts to the reporting to be able to take a look at it in terms of highlighting. So as we move through, those are the highlights of the UD2 enhancements. So when we're looking at this, who does UD2 affect? First of all, it's going to affect all PM users. So your setup team, file maintenance, your billing and office staff need to determine and understand the changes that will impact their workflow. And management will need to look at the training of new features and enhancements that will be necessary for practice management users. Now, what I really want to emphasize here, a little bit different than the EHR, for those of you who may have been on our session in the EHR, this really is something that some of it is workflow impactful, some of it is RTS. As you can see, it's all encompassing, and you really need to decide what you are going to use and what you're not going to use, and then make a plan for it. And that's how you move out into the how. You do it with a plan. You need to have a project. You need to determine who's participating. What is your scope? Create your project charter. Who has the authority? Your objectives, your assumptions and restrictions, and your measurements. And these are all pretty high-level words, but the bottom line is you need to have a plan and come up with your basic steps to an upgrade. And in order to do that, you want to validate which features you're using. Develop your project plan. Determine the requirements. For those of you who may not already be on 5.8 and you're just moving into 5.8, you might have some system requirements that you have to utilize. You need to do a test upgrade. You need to set it up, and you need to test, test, and test. And last, you need to train, train, and train before you go live. And we at Attentive can help you if you feel that you need help. We can either certainly talk to you, give you advice. We also want to know if you feel uncertain about next steps. We can help by providing an EHR workflow, and this would include an on-site assessment and look at your workflow analysis, planning, give you a written report of findings and recommendations. And with this program, we are including all travel expenses. So now as we just continue and finish the presentation, we've got a few minutes to answer any questions that you may have. Myself, Jeannie, and Sean are available to do that. In the meantime, if you have any questions or are interested in any follow-ups after this webinar, you can certainly reach out to the individuals on this, myself or Keith Justice, who's our Director of Business Development. I'm going to leave this slide up if you need to jot down the email address, and then we can take it away with questions.
Hi, Cindy. Thanks so much for that. That was lovely. Okay, first question, patient portal indicator. What about indicators for patients not yet enrolled? Currently, we need to look up each patient to see if a token code was generated.
That has, go ahead, Sean.
Sorry, there's no icon for not enrolled. The icon pops up for patients that are enrolled in several different spots. The one place you're going to be able to look for that now is in the patient lookup. You're going to get a Y for yes or an N for no, and that will tell you when you look the patient up manually if that patient's been enrolled in the portal.
Right. I think the question, though, to clarify and add on to the question, because we've actually developed a number of custom reports for this, you may want to know, do they have a token, but they just haven't followed through and enrolled in that. And that is still a challenge. There are some reports that you can go, and you can go out and look at some different areas, but that's still pretty much the same manual ability of taking a look at that. What I can tell you is that I don't know how many of you are using the auto-enrollment. Now, that's really not anything to do with this particular UD upgrade. However, we have had great success with the auto-enrollment, and that helps a little bit in terms of determining that, because it's just going to continue to do that. I don't know if that helps, but that really hasn't changed. There's no real relief on that. You still have to look at that particular aspect manually. The good news is it will tell you right now if they have, and it's.
Okay, thank you. As a reminder, you can type your questions in the webinar control panel in the questions area, and we will answer them in the order in which they come. Next question. Can we control who has the ability to apply discounts to patient charges?
Yes. Yes, that was one of the exclude options, and there's also in system administration some rights to that. So you can lock it down by group, but you also have the ability to even exclude specific users when you're setting it up in file maintenance.
And what happens if we have the previous bad debt option turned on upon upgrade, but we turn it off down the road?
Take that one. So the previous bad debt option, when you upgrade, is going to automatically be set as normal. You're going to have patients pay off their debt, and they're going to go into history status. If you select a box in file maintenance to keep them from going to history status, which then they'll be in a previous bad debt state consistently, they'll stay that way until it's turned off. If you uncheck that box and put it back to the original option where they're going to go to history status, everything retroactively will become history. And on the same note, if you leave it standard and then down the line want to start using the previous bad debt option that's new, it will not retroactively bring everybody back to previous bad debt. If they have since paid their debt off, they'll stay in history, and it will work going forward.
Thanks. Okay, next question. Do we have to upgrade to UD1 prior to UD2?
No, you do not. The UDs are encompassing. So if you have not done it, you can skip UD1 and move directly to UD2.
Thank you. Okay, let me read this one. Where do notification preferences come into play?
Your notification preferences are set on the demo screen, but they're going to really come into play if you're using population health, if you're using recalls. For those types of applications or add-ons to NextGen, you have a drop-down, and it's going to say either preferred notification or other. If you pick other, typically you get a box where you can type in their email address or something like that. But if you have their preferred set up, you can just click preferred, and it will send their notifications that way.
Thank you. Next question. On the unapplied payment report, was there a DOS field?
I don't recall. I don't remember there being one. Sean, I don't want to.
I'm looking at it now. I don't see a data service field available.
Yeah, I did not. That was not one of the ones listed. So that's a good.
It's a good question. It's not on there.
Well, it's a good thing to have added. I didn't add it with this particular go round.
There is process date on there, though, not date of service, but process date is there. So I think process date is going to pull from the date the charge was processed. So I think they probably chose process date versus date of service.
Okay, well, that's all the questions that we have right now. We're going to stay on and see if anybody else has some more questions to add. Please follow us on Facebook, Twitter, LinkedIn. We're going to be uploading a recording of this webinar to our YouTube page tomorrow. So if you'd like a copy of that link sent to you or a copy of this presentation, please email either of the people that you see up on the screen, and we'd be happy to send it to you. And you can search for us on YouTube just by searching in the box for Attentive. And I'll also be posting a link to that on our Facebook and Twitter and LinkedIn page. So follow us for updates and future webinars. Just a reminder, we do have an upcoming webinar this coming Tuesday, or Wednesday. Wednesday? I thought it was Tuesday. Hang on one second.
I thought it was Tuesday.
Sorry, it is Tuesday, so don't pay attention to the Wednesday date. It's going to be Tuesday the 7th at 12 p.m. Eastern Time, and that's going to be on evaluating your practice's financial health. And Jeannie Logue, who you heard speaking in the middle of the presentation, is going to be presenting that one, so we're looking forward to that. Thank you all for your time today.
Yes, thank you, everybody. We're really excited about UD2. I hope all of you are. One little addition, for those of you who attended the EHR session, there were some questions that we had to research. We have not forgotten. Those will be coming out. We've both just been traveling, and so Jordan and I are pulling those together and should have those out to you no later than Monday for any of you that were on there. So thank you all very much for attending, and please let us know if we can help you in any way.
Thank you so much.